Hello. A lot of people come in and are complaining of having different types of shoulder problems. My name is Dr. Russell Brokstein, Freehold Chiropractor, and one of the things that I find is very important if you do have a shoulder problem is you first have to get the problem assessed to find what the underlying cause is. Is there a possible separation? Are there any rotator cuff problems? Is there any frozen shoulder syndrome? Once we know the underlying cause, we then can start off with a proper treatment protocol that will include adjustments to the shoulder joint, adjustments to the neck and the thoracic region, which can all complement or compromise the shoulder. Once we get through the treatment, another important aspect is strengthening your shoulders. So there are 5 simple exercises that I show all of my patients to get into. And right now I'm going to show you one of the first ones to start off with is going to be internal and external rotation. So what you're going to do is you're going to either get some tubing, or you can even use, right here we have some TheraBands. They come in different colors and resistance. I give these to my patients, but I also like to use tubing, which I already have set up on our wall for this demonstration. So the first exercise you'll do, you're just going to set up the tubing or the TheraBand at shoulder height. And you're going to take the band, and depending on how far you are from the wall, the closer you are to the wall, the less resistance. The further you go away, it's going to add resistance to the tubing or the band. So going at this level, we're going to do an external rotation, keeping the elbow into the body. And you're just going to turn the arm out towards the side. Now the important thing with this exercise is to keep the elbow tight to the body. Now one little trick that I show my patients is taking a towel, and if you take a towel and you put it under your arm like this and squeeze the arm against, or the elbow against the body, and when you do this, it'll help you keep proper form, because form is so important with this exercise. And you just turn out. It's not pulling your arm away from the body like I see many patients do. And if you hold this towel into the body and you do bad form and you pull the arm away, the towel will fall away like that. Okay? So you're going to keep the arm in. I want you to do up to 3 sets of 10 to 15 repetitions. If while doing this exercise you feel any pain, I need you to stop and either talk to me if you're a patient of mine, or talk to whatever doctor you were seeing for your shoulder problem. Now, for the other side of external rotation, we have to do internal rotation. And for the purposes of this video, since I'm already facing this way, I'm going to use the opposite arm. Again, keeping the elbow into the side, you're now going to bring the arm into the body, turning it inwards, okay? So again, we're going to do up to 3 sets of 10 to 15 repetitions. And with all these exercises, I just want you to do them 2 or 3 days a week, no more than that, because these muscles need a little bit of time to recuperate between exercise. Now, those are the first 2 exercises. Those are internal and external rotation. The next exercise I want you to do is called a Saber Exercise. It's basically like if you have a sword in your belt or holster over here, and you're just going to be taking your arm in this position, and you're going to bring it up and out like that. Almost like you're drawing an X on the board or wall in front of you. And this is the tubing I'm using right now, and just for purposes of the video I'm going to show you, you're just going to pull up like that. So down from about the pocket region and up and over. Okay? Again, 10 to 15 repetitions, 2 to 3 Now, the last 2 exercises that I'm going to do with you, again, I just took the tubing off of my placeholder over here on the wall. And with this, you're actually going to take one end of the tubing, and you're just going to put it on the floor, and you could step on it. Alright? And from here, you're going to keep your elbows slightly bent, and you're just going to bring the arm up to the side, just to the height of the shoulder. I don't want you raising it up, because this is where we start getting impingements in the shoulder and you can cause more shoulder problems. So again, you're just going to go up to the side and down. Keep all these motions in a controlled fashion, okay? Just like that. That is the fourth exercise, and the final exercise you're going to do is a front raise. And you're just, again, keeping the elbow slightly bent. You don't want to lock it out. Keeping the elbow slightly bent, and you're just bringing the arm up to shoulder height and down. Again, just like that. All right. Now those are the 5 different exercises that I recommend for my patients. They're really helpful in strengthening and stabilizing the shoulder. Okay, but with the chiropractic adjustments that I do, it's important that we first get full range of motion into the shoulder before we start doing the strengthening. Try these exercises for a while. If you have any problems, give us a call, 732-780-0044, or you can even email me at drbrockstein@chiropractorfreehold.com.